Hi, Assalamu alaikum. This is Azim Khan Wataniyar. Today I'm going to discuss Modifier 27 in medical billing. So, Modifier 27 in medical billing is used to indicate that multiple outpatient hospital evaluations and management services were provided on the same date but different outpatient hospital setting. For example, emergency department and clinics, or by different hospital department. Viewers 27 modifier is usually used to indicate that there are multiple encounters and that are E&M services that's been provided on the same date, and it's in the different department of the hospital or in the different outpatient setting, like for example emergency departments and clinics that have been performed. And then we can use one of the procedure code with 27 modifier. Here is the definitions of 27 modifier. The definition is multiple outpatient hospital E&M encounters on the same date. This modifier is appended only to E&M codes and is used by facilities, not physicians, to show that more than one outpatient encounters occurred on the same day and all are medically necessary. Viewers, as per the definitions, you have seen that the E&M, it's been used in the E&M services and it's been used for the facilities, not specifically for the physicians. It shows that this, more than one outpatient encounter has been given to the patients, and that is on the same date. And the most important thing there is actually the medically necessary that was used, right? So here we go with when we can use modifier 27. So when a hospital outpatient department sees the patients in more than one setting, ED, emergency departments, and clinic on the same day, each encounter must be distinct, medically necessary, and separately documented. Okay, so a modified 27 is, as you can see, the description's been given, that is in multiple settings, more than one setting the server has been provided. And but the most important thing is these encounters being performed on the same day, right? And make sure these encounters must be distinct and it should be medically necessary, and also they should be separately documented. Here we can go with an example. A patient is seen in emergency department in the morning for the chest pain. After an initial evaluation, they are discharged. Later the same patient visit the hospital cardiology outpatient clinic for a follow-up consult. Okay, the descriptions they've been given here showing that a patient's having pain on chest and he visited the emergency department at the same time in morning, and he was actually once a physician there in the hospital that having like the specialty of chest. And after that he's been discharged on that day in the morning time, and then later on the day he visited again the hospital for the cardiology outpatient clinic for the follow-up consult. So here we can claim those, like we can submit the claims in the E&M shape, like 99284 for the emergency department visit and 99243 for the clinic visits. As you know that in the descriptions I was explaining you that initially in the morning time the patient was visiting like the hospital for the chest pain complaint, and then later on he visited again for the cardiology consultation. So here we can go with two CPT codes, but most importantly, as we know, modified 27 is appended in the E&M services, but we can use one of the two, like one of the CPT code in both of it. Like if we can use it 99284, we can use 27 with that. The other one will be billed but without modifier 27. The same case if we put 99243 with modifier 27, the other one will be sent empty. Practical example number 2, a cancer patient receives a care at a hospital oncology department in the morning, then visit the hospital palliative care clinic in the afternoon for the pain management. Both services are distinct and separately documented. The second E&M service would be appended with modifier 27. As you can see the example, the patient who has a cancer complaint, and he visited the oncology department in the morning time, and then he visited the palliative care clinic in the afternoon for the pain management. So here are the two different encounters, the distinct encounters, which can be separately documented, and as we are talking about the modifier 27, so we can use with the second E&M services. Thank you so much for watching. Have a great day. Bye.